Hello, my name is Rebecca Alexander, and the public health issue that I'm going to discuss today is heart disease. I wanted to discuss heart disease today because, according to the CDC, heart disease is the leading cause of death in the United States, causing about 1 in 4 deaths. The term heart disease refers to several types of heart conditions. In the United States, the most common type of heart disease is coronary artery disease, which can lead to a heart attack. You can greatly reduce your risk for heart disease through lifestyle changes and, in some cases, medicine. Based on the NPR article dated April 10th, 2021, titled Heart Disease is Still a Killer, Here's How to Reverse It, I chose heart disease as the topic for my Zoom presentation because it is the leading cause of death in the United States. My maternal grandmother died of a heart attack in 2017, and my paternal grandfather died of a heart attack before I was born, so there's a personal connection for me as well. Since I have a family history of heart disease, it is important for me to do everything possible to prevent having this comorbidity. The article delves into what causes heart disease. According to NPR, when plaque made of cholesterol, fat, calcium, and other waste build up in the vessels of the heart, what we call atherosclerosis, coronary heart disease develops. It's the primary cause of heart attacks, which occur when those vessels become completely closed off by a growing plaque or one that's shaken loose and stops blood supply to the heart. It happens to someone in the US one every 40 seconds. The NPR article discusses ways to prevent heart disease. The article details the first step in preventing heart disease is establishing a baseline and estimating how high your risk is. To establish a baseline, you need a reading of your blood pressure, average blood sugar, and cholesterol levels. These numbers are sometimes the only cues we have to a patient's risk of heart disease, and that's because they are the three most common culprits in heart attacks. Those three common culprits are high blood pressure, diabetes, and abnormal cholesterol levels, which are often present without any symptoms. A primary care provider can help guide their patient through getting these levels and explaining how high their risk of heart disease is. Another factor that directly impacts heart disease is obesity. In this article, it stresses the importance of maintaining a healthy weight. It also covers the idea of cutting down on high sodium processed foods. The article stressed eliminating packaged foods high in sodium like deli meats and instead increasing your fruits and vegetable servings. Other foods to increase in your diet are foods high in fiber like beans and oats, and healthy fats like nuts and avocado. Another risk factor that was discussed in the article was the importance of physical exercise on the heart. According to NPR, when we ask the heart to work more during physical activity, it floods smaller vessels to get more blood pumping through the heart and out to the body more quickly and efficiently. The same vessels may not otherwise be capable of supplying blood if others get blocked, as in the case of a heart attack. Short bursts of exercise are great for heart health as well, and can be done in smaller spaces and in less time. Just 60 seconds of high-intensity exercise, alternating with a minute or so of rest in between, for a total of 10 to 15 minutes almost every day, gets you to 75 minutes a week of high-intensity exercise, recommended for all Americans. Smoking is a major risk factor of heart disease. Smoking is one of the riskiest things you can do when it comes to heart health, since it speeds up the creation of those cholesterol-laden plaque and has other inflammatory effects on our tiny heart vessels. According to the article, smoking cessation means an instant drop in the risk of having a heart attack, and quitters can boast a drastic drop in the risk of having a heart attack within 1 year of being tobacco-free. The final risk factor for heart disease that is discussed is genetic predisposition. Earlier, I stated that I have a family history of heart disease, and having a family history means that I'm at a 30 to 40% risk of developing heart disease at some point during my lifespan. Genes increase the risk of heart disease, but an unhealthy lifestyle and diet increases your risk even more. The risk factors for heart disease that were not addressed in this article are diabetes and alcohol consumption. Over time, high blood sugar can damage blood vessels and the nerves that control your heart. People with diabetes are more likely to have other conditions that raise the risk for heart disease. According to the CDC, if you have diabetes, you're twice as likely to have heart disease or a stroke than someone who doesn't have diabetes and at a younger age. The longer you have diabetes, the more likely you are to have heart disease. Over time, excessive alcohol use can lead to the development of chronic diseases and other serious problems, including high blood pressure, heart disease, stroke, liver disease, and digestive problems. Since heart disease is the leading cause of death in the United States, it is paramount that education on preventing heart disease should start at a young age. I propose that school districts reach out to community health nurses to set up days to come to each school in the district, starting as young as elementary school, and have the opportunity to educate students and answer their questions they have on heart disease. This would be something like an auditorium presentation where a community health nurse can come with pictures and visual cues to garner the attention of the students and teach them in layman's term on their level how dangerous eating unhealthy and no exercise can impact you later on in life. The earlier the education begins, the better. Students can learn that a healthy diet and physical activity can prevent heart disease. The one intervention from the public health interventions wheel that applies to this is individual focused. Heart disease kills about 655,000 Americans per year with grim statistics like that, it is important to begin educating individuals on how to prevent becoming a statistic. COVID-19 negatively impacted heart disease. COVID-19 can cause multi-organ damage, including both direct and indirect damage to a person's heart. One way COVID-19 can affect the heart is by invading the heart muscles itself, causing inflammation within it and, in severe cases, even permanent damage via muscle scarring or muscle cell death. According to the Houston Methodist Leading Medicine, COVID-19 can also cause inflammation in the lining of the blood vessels that transport blood and nutrients throughout the body. This ultimately can lead to increased blood clot formation and a greater likelihood for these clots to stick to the walls of blood vessels, further increasing the risk of heart attack or stroke and potentially causing low blood oxygen levels. At the height of the pandemic, everything was shut down, which means that people were not able to go to the gym and work out. In my community, there's one gym in a central location where the residents of Baldwin go to work out, and that gym was closed through the height of the pandemic and opened up. I want to say it opened up in the end of 2020, but with major restrictions. So if you didn't show up early, the gym was at capacity and you missed working out. So in instances like that, it impacted people who were trying to get back on a healthy routine, but were unable to due to the increased danger and increased limitations that COVID placed on businesses. Since exercise is a major component in preventing heart disease, it was difficult for people who were used to a routine to step out of that and find alternative ways to stay fit.